face coverings and social distancing. Our new way of life is stressful both physically and mentally. But imagine voluntarily surrounding yourself with people you know are sick and in return could infect you with coronavirus. And that's what our healthcare workers are doing. And the recent suicide of a New York ER doctor reveals the toll it can take on mental health. So joining me this morning to weigh in on how local doctors are handling their own mental health is Dr. Chris Colbert with the University of Illinois at Chicago. Good morning to you, Doctor.
Good morning, Colbert. How are you doing?
We are doing good, but how are you doing? That's what I want to ask. How are you and your colleagues doing?
Thank you for asking. I think that all things put in context, we're doing very well. There's a lot of support for first-line providers, and there's a lot of policy in place to ensure that where we work, in fact, is a safe place emotionally and physically for the patients, as well as for the attending physicians. There is a significant emotional toll of just being a first-line provider. And specifically in the context of COVID-19, we've seen a significant increase in volume of morbidity and mortality. And just by being a human, that will result in a significant draw of emotion.
Of course,
and
of course.
To support that, we have different policies in place.
So before we get to those, as an ER doctor, you've seen everything. And but because this came on so unexpectedly and so fast, this even had to kind of pull the rug from under all of you because it was not expected. So what are you doing? What can you do to help each other? Because when you're there working, you're in this little bubble, and we can't even begin to imagine as outsiders what this is like. So what steps are being taken to make sure that you and your colleagues can handle this?
No more.
That's a great question.
No, Farrell.
Again,
no more.
There's a
no more.
That we're all in this together, and that
no, Farrell.
Within the medical community,
no.
There's significant support. There's both in staff support. There's online support references. There's phone resources as well. Specifically in the emergency room, what we do is around 4 to 3 hours every shift, we have what's called a huddle, and this is practiced in a lot of the ERs. And during that huddle, all of the staff, the nurses, the ER physicians come together. We discuss the patients in the emergency room, and also there's a quick check-in as well. We check on the vital status of each other, make sure we're doing well. Specifically at the University of Illinois, we also have what's called a Care for a Caregiver program, in which there's peer support for those staff that have lost patients, just to ensure that we maintain a very healthy working environment.
I'm so glad to hear about that. I know you have lost some workers as a result of this virus. And I have to wonder, every day you go in there, and for the workers that you have lost, you might be wondering, why did that happen to that person and it didn't happen to me? So every day you go in there, you say they're taking great security measures for you guys. You guys are doing it
no,
as well,
Farrell.
but you truly are putting your lives at risk.
That's a good point. There's a part of this where, as healthcare providers, when patients come to the emergency room, they expect a specific answer. They anticipate a timeline in which they'll get better. And specifically with COVID-19, we can't supply those answers. Everything is so dynamic, and coupled with that, we want to provide those answers. And in the context of COVID-19, patients, you want to be able to say, you'll be better by Tuesday, you'll be better by 5 o'clock on Wednesday, but that just doesn't take place. That's just something we cannot do. And there's an emotional toll with that. You want to be able to say, and look at the patients and say, you know what, you'll be great in 2 days, or you're doing the best we possibly can, and things will turn out very well. And there's a little bit of delay in progress, things change, physiology has an effect as well. And with that, we just want to keep the environment very positive, communicate with one another as staff, ensuring that just kind of checking in with each other, ensuring that we are feeling well, that we are having good conversation, peer conversation, in support of what we're doing as well.
Well, thank goodness that you guys all have each other. And I'm sure that when people say thank you for what you're doing, it means a lot to you. So I want to personally thank you and all of your colleagues. Stay healthy, and you truly are heroes in this horrible situation that we are all going through right now. So thank you again.
Thank you.
Thanks for joining us, Dr. Colbert.